Good afternoon, and welcome to this webinar on COVID-19 behind bars. We're thrilled to have you join us today for this important and timely conversation. For those of you who don't know me, I'm Marc Howard. I'm the founder and president of the Frederick Douglass Project for Justice, and I'm also a professor of government and law at Georgetown University, where I direct the Prisons and Justice Initiative. I founded the Douglass Project because I believe that our criminal justice system, and by extension, our society overall, has neglected the humanity of incarcerated people. I believe, and I've seen firsthand, that we can create a more equitable society when we consider the human impact of decisions and policies that affect so many Americans. And that's why today's conversation is so important. There's no doubt that COVID-19 has been devastating for everyone inside of prisons and jails, both incarcerated people and correctional staff. We've all heard news stories about the virus's catastrophic impact on prisoners and their families, as well as on correctional officers and facility administrators who are working to manage the day-to-day challenges of the virus in conditions that are almost by definition the opposite of what is required to defeat a pandemic. Across the country so far, over 150,000 people in prison have tested positive for COVID-19, causing at least 1,250 deaths. And more than 32,000 correctional staff have tested positive, leading to at least 86 deaths. Today, we're fortunate to be joined by two featured guests who are leaders within New York State's Department of Corrections and Community Services, or DOCS. They both have distinguished careers in which they've created and implemented programs and policies that focus on the humanity of the people they impact. Acting Executive Deputy Commissioner Daniel Martuscello and Sing Sing Superintendent Michael Capra will provide us with an engaging conversation about the challenges of COVID-19 behind bars from the perspective of correctional officials who want to protect the health and well-being of incarcerated people and staff. I'm delighted also to welcome my co-moderator for today's event, Lawrence Bartley, the director of News Inside, an IZZY award-winning print publication of the Marshall Project, which is distributed in hundreds of prisons and jails throughout the United States. Lawrence is a leader in the criminal justice reform world. He holds a bachelor's degree from Mercy College, an advanced degree from New York Theological Seminary, and he serves on the boards of several organizations. He's also a co-founder of the Sing Sing organization Forgotten Voices, now called Voices from Within, which highlights the individual stories of redemption through short films produced by NBC's Dan Slepian. Lawrence is an accomplished public speaker and writer. He provides multimedia content for CNN, PBS, NBC Nightly News, MSNBC, the New York Emmy-winning three-part series Drama in the Big House, NPR's All Things Considered, WNYC's Death, Sex, and Money podcast, a TED Talk, and more. So thank you, Lawrence, for being with us today and sharing the moderating duties with me. You're muted, Lawrence.
Thank you, Mark. Thank you for having me. And I would like to start by introducing two of our featured speakers. Acting Executive Deputy Commissioner Martuscello III began his career in corrections in 1997 as an officer trainee. He transitioned from security to administrative services in 2001, where he held a variety of titles within the Bureau of Personnel, including Director of Human Services. In 2012, Mr. Martuscello was appointed Deputy Commissioner of Administrative Services, and most recently to Acting Executive Deputy Commissioner for New York State's Department of Corrections and Community Supervision, making him the highest ranking individual in the department, the second highest ranking individual in the department. Our second featured guest is Michael Capra. He has, for the past 8 years, been the superintendent of Sing Sing Correctional Facility, a maximum security men's prison located in Ossining, New York. As superintendent, Mr. Capra oversees one of the largest maximum security correctional facilities in the state. He has over 39 years of experience in corrections and law enforcement having started his career in 1981. And he is a nationally respected as a warden who provides opportunities to his residents, including the Voices from Within group, who I was a part of, an anti-gun violence project, several TEDx events, and other innovative programming. I would like to also take the time to say something personal about Mr. Michael Capra. Not only is he a leader, as I mentioned, in his facility and nationally known, he keeps that the power dynamic between incarcerated people and the way he should present himself, the way his position calls for. However, he also takes moment to get to know each of the men and try to provide advice whenever he deems it's necessary. I remember one time when it was one of the best times of my life when I was released from prison. Michael Capra came to me and said, you know, you lead a lot of organizations in this facility, but I'm gonna give you one bit of advice before you go home. So when you get home, you're not the leader of your household, your wife is the leader. Make sure you remember that. And that's the best advice he ever gave me. And I listen to that advice every day, and a happy wife means a happy life. Mark?
Thanks, Lawrence. We're also honored to be joined by Dr. Carmelle Norice-Tra. Dr. Norice-Tra is an infectious disease specialist at the National Institute of Allergy and Infectious Diseases at the National Institutes of Health. And she also serves as a member of the board of directors of the Frederick Douglass Project for Justice. I want to add that Dr. Norice-Tra has a unique perspective on this topic. Many of you know the expression, the family does the time too. Well, for the last 24 years, she has done time with her father, who is serving an enhanced 99-year prison sentence in Texas for aggravated robbery while under the influence of drugs, and I might add, a crime in which nobody was hurt. She has channeled her energy from this difficult personal experience into serving system-impacted individuals and families in various ways. And I have to note that the opinions that she'll express today are from Dr. Norice-Tra's own perspective, and they're not intended to represent the viewpoint of the US Department of Health and Human Services or the NIH. And Dr. Norice-Tra serves on the Douglass Project board in her personal capacity. So let's get started now. And I want to mention to our attendees, please feel free to ask questions and make remarks using the chat feature that will come to us, and we will answer and address them as time allows at the end. Now, I want to start with Dr. Norice-Tra and ask if you could explain to our audience some of the specific COVID-19 characteristics that make this disease particularly difficult to manage in a prison.
Thank you, Mark. So COVID-19 is primarily transmitted from person to person through droplets that are released into the air when someone sneezes, coughs, or even talks. And these infectious droplets can then land in the mouths or noses of people nearby, or they can be directly inhaled into their lungs, transmitting the infection. So in a prison setting where people are in close living quarters and overcrowded in some cases, unfortunately, it can be difficult to control the spread of infection. In addition, recent data suggests that there can be transmission of the virus through droplets of people with mild or no symptoms at all. So transmission is possible among groups of asymptomatic people. Moreover, the onset and duration of viral shedding and the period of infectiousness for COVID-19 are not yet entirely known. So these are some of the characteristics that make COVID-19 hard to manage in a prison setting.
Okay, well, the next question is for EDC Martuscello. Now, a lot of people probably don't realize that there's over 50 facilities under DOC's control. And each of those facilities, not only are they structurally different, they all have their own unique personality and unique staff that have their own personality. So keeping that in mind, I want to know what are the biggest challenges has the virus presented to you, and how do you meet those challenges in each facility, knowing that each facility is different?
Yeah, thank you for the question, Mr. Bartley. So as you mentioned, the department operates 52 correctional facilities across the system. As of today, we have 36,000 76 incarcerated individuals in the system, which is 8,000 less than January 1st of this year. And it's actually 50% less than our high in 1999 and the lowest point that we've had since 1986. Each facility is uniquely situated, separated by security level, maximum, medium security, with different configurations, either prisons that were built for the purpose of being prisons, medium security, or repurposed institutions that were previously used for different functions. The department long ago had pandemic flu plans in place to prevent infectious disease. We've managed through a number of infectious diseases, whether it be TB or other airborne pathogens. So when COVID-19 hit, we were uniquely situated that we had a structure in place that we now had to take a look at COVID-19 and make modifications to the plan. Each of the institutions has its own independent plan for how we isolate and quarantine individuals. Facilities have isolation rooms, and in some cases where there's smaller facilities where the isolation rooms were not as many as necessary, we utilized other prisons to house individuals to provide the medical care they're needed. So we at DOCS early on began running tabletop exercises with our superintendents to make sure that they were prepared for an outbreak in their institution, make sure that they reviewed their pandemic plan and the areas for quarantine. We actually tagged it as what I like to refer to as the three-legged stool that we implemented, whereby we have locations for people that are displaying symptoms that we can isolate and test. When individuals come back positive, a location where positives can be housed, as well as when we do contact tracing, a place where we can quarantine and test individuals. So we went over this with each institution, held regular phone calls that continue this day with the institutions to make sure that they have a plan in place, they know where they're going to house individuals if and when this infection hits their institution.
Wow, that seems like a lot to manage. How much of the plan is decided by central office and how much is decided by each facility? Can you kind of put a percentage on it?
Yeah, I mean, we're a paramilitary organization in a lot of senses. So the policies were all driven centrally and in accordance with public health officials, either by the Department of Health, which we're in constant communication with, or by CDC guidance. And then we issue policies and procedures that flow in accordance with those guidelines. And then we follow up individually to make sure that how the policy is implemented. So it is truly a top-down approach in terms of implementing uniform policies, whether it comes from the three-legged stool approach or the cleaning protocols, the testing protocols, and what have you. And part and parcel to that is also some of the early decisions we made, which were difficult ones, like suspending visitation, which we know are so vitally important to the population and their families. Family reunification is really critical to the men and women that are incarcerated in our system, as well as the families, as the doctor says, that are doing time side by side with their loved ones. So that decision to stop or temporarily suspend visitation, the suspension of programs within our institution, the minimizing the movement and the intake, all centrally pushed out to the system to make sure we had a consistent message and everybody understood the protocols that we put in place.
Okay. Superintendent Capra, now from where you're sitting, the edict comes down from the central office and you have these guidelines to follow. On the front line, how do you effectuate these guidelines practically, and how is the collaboration process with central office?
Well, our collaboration is pretty close. As EDC Martuscello says, that we have been constantly on phone calls every week. Initially, it was 3 or 4 times a week, sometimes around the clock, sometimes it was 7 days a week. So our information was very clear. Our direction was very clear. On the facility level, it's up to each individual superintendent to make that work in their facility. The pandemic hit everyone. Nobody thought we would deal with something like this. So it was more keeping people calm, being very transparent in what we were doing, and making sure the communication was very clear to both the staff and the inmate population. We held meetings in our auditorium early on, and we spread inmate population out. So as you know, it's the ILC, Inmate Liaison Committee. We started with information to them very quickly. At the same time, we had to make sure that all the staff knew the direction, understand which way we were going, and to put things in place that made sense to everyone. So staff, for instance, we didn't even want to do a lineup, which meant, as EDC Martuscello says, we're a paramilitary organization. So in the lineup, it's much like a roll call where everybody stands at attention and dress right, dress ready front, and then we brief the squad. What we did was we held a lineup outside in the parking lot, and we spread everybody out. And in the early times, to make sure the staff understood, we still, as an executive team member on a local level, we understand the fears that everyone has. It wasn't just the population, it wasn't just the staff. So understanding that this approach to communication and understanding how everybody was feeling, including, all of us, we all had questions. It was critical to be able to deal with people on that type of level where everybody really understood what we were doing. So inside the facility, it wasn't just the ILC, because when we gave out information, it really wasn't getting to the whole population. So we added other groups like inmate organizations. We added all the clergy, the inmates who were clerks in clergy. So we went from a small group of inmates to probably somewhere in the neighborhood of 45 to 50, spread them out in our auditorium, as you know, is pretty good size. And we had these meetings at least weekly. And it looked a little like a press conference because people didn't know, or they were glued to CNN and the rest of the TV. And there was different information early on with all the different experts that were out in the field that were on TV. So a lot of it for us was to keep everybody calm, let them know what our plan was going to be, and enact those plans. And it was very difficult, I will say, and it was an emotional roller coaster with both staff and the inmate population.
Thank you for that answer. And I want to drill down a little bit deeper, Superintendent Capra, in terms of how you, as the superintendent of one particular facility, and obviously a major one with the legendary history that we all know Sing Sing has, but also working within a system that has multiple facilities all over. When you have this fast-moving situation, a lack of information, tremendous fear all around, both outside and inside, were you focusing strictly on Sing Sing, on your population, on what you could be doing inside? And did you have autonomy to be making decisions internally as the situation was changing? Because obviously outbreaks were happening in different ways in different facilities. So this is a case where maybe a centralized response wouldn't be appropriate when different facilities are in different situations. And so I'm wondering how much kind of independence and autonomy did you have versus kind of the larger state level approach? And I'm thinking of this nationally as well, because the reactions were very different all across the country. So how did you, as the leader of an individual facility, feel that you could respond to this fast-moving crisis in a climate of tremendous uncertainty?
Good question. Well, I will say that as we said before, we had an open line of communication. EDC Martuscello said before, we had a very open line of communication. It was constant. So decisions were being made, and we were implementing those decisions at the facility level. I think the difference, or the specific facility, my facility, is understanding how people think, what their fears were, and trying to really settle everybody down, knowing that we're all in this together. The difference between this pandemic and most scenarios are, when I spoke to the incarcerated men in the facility, I asked them for their cooperation. I asked them to work with us side by side, because this was a human being situation. This was not, security staff and inmate population, in some kind of an event. This was a national event that COVID didn't know the difference between the superintendent and the man who was doing 25 to life. And so that was clearly made. And when you approach a situation like this, on a humanistic level where you need everyone's attention and everybody's cooperation. I think that set a certain tone where both staff and the population understood that we're going to make this, we're going to get through this. We're going to make this happen and the safest way we can, and we're going to get through this. And we're still dealing with that, but understanding how people, their fears and some of their thoughts and answering as many questions as we could with the information that we had was critical. Without communication, people start to think up their own answers, and sometimes that's how panic begins. And so we were very keen on that from the beginning, understanding both staff and the inmate population and how we were going to push forward and make this our number one, obviously our number one priority, but thinking things through and on how we were going to get that information out. We have a TV, we're called a TV facility. So almost every incarcerated person in my facility has a TV in their cell. And during that TV process, there's a channel that we use. We use that channel also to give up daily information on what was new from CDC, New York State Department of Health, and of course, our principals in central office. So that helped us out also. So communication, I have to say, was probably the key component in being able to establish the safest facility that we could, meaning individually, taking into consideration the masks, the washing of the hands, the social distancing, what it was going to take to get through all these processes, and how we were going to do it at a facility. I think the communication was key in that.
Okay, Superintendent Capra, I want to take you back to the old world for a minute. In the old world, you had a facility where staff members come in, they know they post. They might work in building 8. They might work in the school building. They might work in the blocks. Then you have incarcerated individuals who go to programs in the school building. They go to the chapel. And I know when I was there, the school building was the lifeblood of the entire prison. Now, people, both staff and incarcerated people, found value in that. You know, they found their place. So people are creatures of habit and they don't like change. So early on in the pandemic, how did you deal with that? How did that change occur, and how did you deal with it from a facility standpoint?
I'll go back to the communication piece and being out there. There's nothing that replaces myself, my team, all being out there, making rounds, talking to population, calming everybody down, answering questions. They saw me out there. They saw my team out there. They knew we weren't hiding in a room up front, right? We had our masks on. We were washing our hands. I went into every single one of the inmates who were positive COVID and spoke to them at bedside. And I did that for a number of reasons. One is I believe in what CDC, New York State Department of Health, was telling us. I had the appropriate PPE on and spoke to every single one of those guys, and including the population. When you're out, and as you say, Lawrence, you know, the norm was, you know, this hustle and bustle of the day, going to jobs, going to programs, going to school, and all that came to a halt. The putting things in perspective of being safe was much more important at this time than doing all those. And don't forget, it was the same on the street. You know, you couldn't get, you know, paper towels from the stores. People weren't going out. People still can't go to hospitals and visit their loved ones in nursing homes and things like that. So putting that all in perspective with population and bringing my team together as a group of people and getting us out there to speak to everybody's staff and the incarcerated was critical. And you have to look at it through a certain lens when you're dealing with something that we've never dealt with in our entire lifetime. So having all the people, staff and inmate, understand that we were all in this together and we're moving forward as positively as we can and being as safe as we can, I think that settled a lot of people down. They knew that we were real, they knew that we were transparent, and we were doing the best we could, and we couldn't do it by ourselves. We needed to have this different approach. It really was every human being that was inside that facility had to be, you know, basically rowing the boat in a certain direction for us to be as successful as we can be and as safe as we can be.
Okay. So now that was about 7 months ago-ish, 7-8 months ago. So what is the day-to-day life like now in Sing Sing?
Well, as you know, we're starting to open up now. So our visits are back, but we do it differently. We pre-screen everyone, whether they're visitors or staff, and we have a questionnaire with the states that are on the list of, have you been in these states within the, in the recent past, and are you feeling a certain way? And then we take a digital thermometer and we test everybody. And I think that's probably standard almost everywhere you go nowadays. The way we've configured the visiting room is that there's a social distancing. People can embrace briefly when they come in with their masks on, and the incarcerated on one side of the table and their family members on another. That made a big impact to the population when we started visiting again. Programs, they are probably half full right now. We have each room is set up differently now, with social distancing in mind, enforcing the masks for everyone, enforcing washing hands and educating on washing hands and how important it is to social distance. So it is definitely a different type of world that we are in now, but I think everybody's feeling it, whether you're inside a facility or a hospital or in general public. We're just doing things differently, and this has become our new norm. Being safe, understanding that you shouldn't be coming to work in any place where you are, especially in this season, with any kind of cold or flu-like symptoms, to stay away. I mean, those are all the things that, they are problematic when you're dealing with staff and bringing people to work and making them feel a certain way. And I think we've been relatively pretty successful in everybody understanding this is how we're going to live our lives right now during this pandemic. And if we do it within those guidelines, I think we're going to be in a good place. And although we are looking at things differently than we ever have before for obvious reasons, I think it's become a positive thing. People are realizing that we're doing things differently, and they know why we're doing them differently.
All right.
I want to jump in and pivot on the theme of family that was brought up in talking about visits. And I want to bring in Dr. Norice-Tra here. And this question is really not for you as a doctor, but as a daughter. And it's a personal question, which is, what has it been like worrying about your father during this crisis when you've yourself been on the front lines in terms of all the research and understanding the disease? Have you had access to him directly? Have you been able to communicate? How has it been obtaining information, in this case from the state of Texas, from his facility, and just to understand how the virus has impacted people incarcerated there and your father personally?
Thanks, Mark. So my dad is a 74-year-old veteran, as you mentioned, serving his 24th of 99 years in Texas for robbery offenses related to drug addiction. And as an elderly African-American male in prison, he has multiple high-risk factors, not just for getting COVID-19, but also for developing significant complications and death from COVID-19. So like many people across our country with elderly loved ones behind bars, this has been a tough period for me and my family. I've been praying for his health and safety and looking forward to every phone call throughout the pandemic. I've written letters to the governor and the Texas Department of Criminal Justice's executive director, pleading for the release of my father to home confinement to no avail. The Texas Correctional and Detention facilities have the highest number of COVID-19 cases and deaths in the country. But I am grateful each day that my dad is still alive and I am still trying to get him home. So visitations have been suspended in Texas and there's no time frame as to when they might resume. But thankfully, I visited my dad in February before things shut down. So regarding obtaining information about how the virus has impacted his facility or him specifically, I've called the unit and they direct you to a generic line where general information about precautions is given, but no specifics about his unit are given. So I've had to rely on my dad and a cousin who is also at his facility to tell me what's going on inside, whether they're okay, whether there's masks, social distancing, hand washing, etc.
Thank you for sharing that, Carmelle. And, it goes without saying that your dad must be just extraordinarily proud of you, and the connection you have is so real, and we really feel it. And I want to now turn to EDC Martuscello, and in a way incorporating Dr. Norice-Tra's answer. There's been a lot of media coverage and attention that's been given to the impact of the virus on prisoners and on their families. And I'm wondering, to what extent has there been a consideration in the discussions that you had at the state level, at the centralized level, of this impact, and hearing about these personal stories, and really a struggle of suffering, in some cases of death? How has that impacted the discussion and the decision-making process at the state level in New York?
Yeah, I mean, here in New York, we take pride in all the programs we offer and all the family reunification opportunities within our institutions. So when we had to make the determination early on to seal off our institutions and close movement and impact programs, and particularly visitation, where we know it's an essential part of where a loved one can come and see that incarcerated individual, sit with them, have real conversations, break bread across the table, bring children, spouses, parents, that was a really tough decision on us to make that determination to stop visitation. I think it was a necessary one, and as Superintendent Capra said, it was something that it was successful in terms of controlling the virus, in that we were all in it together. I think it was clear to the incarcerated population why it was necessary, even though disappointing. Same to the families, why it was necessary, yet disappointing. So we then turned to take a look at how else can we build family reunification and make sure we have that connection, so loved ones in the community, like the doctor, can speak to the incarcerated person regularly, or speak to someone in the institution to hear about what's going on with my father, what's going on with my loved one, what are the conditions in the facility. So we did a few things. First, we engaged our vendor community with our inmate phone program, as well as our tablet program. Probably about now 2 years ago, we embarked on a contract where we gave every incarcerated individual, free of charge, a tablet, because our commissioner was set on not having the haves that could afford it and the have-nots, right? We wanted every person to have access to that tablet and access to education material and secure messaging and things of that nature. So with that new technology in hand, it's really been something that has gone a long way. We were able to successfully negotiate with our vendor community the ability for, at one time, up to 3 free phone calls a week, up to 2 free stamps to allow for a secure message. On Wednesdays, the incarcerated population, every time they get a secure message in, they get a free reply that they can reply at any time to their family members. So we really tried to leverage those mechanisms to keep the population in touch without having a cost factor. Granted, we have some of the lowest phone rates in the nation, but we still wanted to make sure that every individual had the ability to reach out and speak to a loved one when they needed to, and offer that week after week. That still goes on today. We continue to carry that forward. Even though we have restarted visitation in the system, we still continue to work with our vendor community. Additionally, it's important that when family want to find out what's going on with their loved one, they have a concern that they may have comorbidities, or that they may have other diagnoses that may lend themselves to be vulnerable, that we have an ability to call the facility. Each of our incarcerated individuals has an offender rehabilitation coordinator, formerly known as our counselors, that will take calls from families, engage them in dialogue. Obviously, we have to have medical releases to be concerned with HIPAA, but the general health and well-being of individuals, it was critically important to make sure that we were sharing information with loved ones. Lastly, we started posting on our website all of our data. We post that weekly, or during the week, 5 days a week. It's updated on our website regularly, both for incarcerated individuals, parolees in the community, as well as aggregate data relative to staff. So again, getting back to the communication, it was really important, and making sure that family, when they called us, they weren't just getting that recording or generic information. We wanted them to be able to reach out and touch someone, whether it be the incarcerated person or a staff member. And again, we're not perfect by any means. I'm sure that there's a story out there that it didn't go perfect, when a loved one reached into our system. But that's what we strive for each and every time.
Now I want to turn to Superintendent Capra again. You know many of your staff members personally. You also know some of the men that are incarcerated in your facility. How do you manage the emotional impact of the virus, both on them and to yourself?
That's a great question. I think most of the work has been done in that realm of really understanding what we have in front of us and how we're going to get through this, and being positive, being confident in our principals, EDC, the commissioner. We were very confident, and when they gave direction, they gave it in a certain way that we were able to really grab hold of it and get that information out. I mean, there were plenty of fears, and there still are. And some of the incarcerated men didn't want to come out of their cells. That was an issue. And some of the staff didn't want to come to work, and that was an issue. So I think the culture that we built surrounding how we were going to communicate with everyone, and being really, you have to be a human being. You have to know, people have to know that you care about them. And in the world of prisons, that's sometimes lost. And so as the people who are running that institution, people knew we cared about them, we cared about one another, and that's every human being that was there. And we were concerned with everybody's welfare. And I think when your track record represents that type of culture, and then when something like this happens, there's a sense of confidence that we are all in this together and that we are going to get through it. You know, with the masks, the social distancing and the hand washing, I mean, we really pushed that heavily, and to get everybody to buy in on that was comforting to know that there was a level of control and we had something to say about this pandemic. If we followed that direction, we were going to have a level of success. And I think we have had that. The fact that we've come up with different areas in the institution to separate people who are actively sick, people that were recovering, or even folks that were contact traced, and be able to solidify that in a very short period of time, different from other, you know, flu or the measles and this particular type of pandemic that we were first time dealing with, to be able to come up with that, as EDC Martuscello said early on in this process. You know, he came up with a three-legged stool, which that type of communication to the 52 facilities that are out there made it clear to each one of the superintendents they knew what they needed to do inside their prison to effectuate all these changes and make it so that both staff and the population, incarcerated population, understood what we were doing and why we were doing it. Little things like the cohorted areas. We wanted to make sure that there was soup and crackers and things that you would have if you were home, rather than just the regular meals that everybody has, breakfast, lunch, and dinner. So there was a feeling of, they know what it's like when, you know what it's like when you don't feel good. What do you want to eat? What do you want to talk about? I mean, what do you want to intake? You know, conversations with my whole entire medical staff about, you know, what can we do to make people comfortable in these areas that they're now not in? Should we give the men their property? So these are the things that we dealt with earlier on, so that people weren't hiding in their cells and getting the treatment that needed. And I think that was very important for the staff to see that and understand it and be involved in it, where I had a lot of staff members that were acting, you know, like they were medical staff. You know, how are you feeling today? And asking questions. And I got this from the population. How, you know, the officers are asking the staff, the inmate population, how are you feeling today? Are you feeling all right today? I mean, both physically and mentally. So that kind of culture, building that type of trust between the incarcerated people and the staff, all the staff, was something we haven't seen before. And many of the men have articulated that to me so many times, especially, you know, early on when things were really out there and this was building, and, you know, that's all we could see anytime we turned the TV on or we were living through it. You know, that's what people were talking about.
Yeah, I can't tell you how much I appreciate that response. And I would add to the list just the fact that you'd be willing to participate in this webinar. I don't think that there are many states, and I don't think there are many correctional officials who would have the level of transparency and openness and willingness to engage with the public on this issue. So we really appreciate that, and it's a great service to the public. It looks like we may have lost your video. I hope you can still hear us. I have a question for you. You can hear us? Okay. For EDC Martuscello. We're starting to run low on time, and we have a lot of questions that have been streaming in. I want to make sure we get to some of them at least. But very broadly, and then if you can answer briefly, which I know is challenging, when you think about criminal justice reform, and you're the deputy #2 in a major state that's had a lot of changes in criminal justice, as you mentioned at the beginning, what issues do you think need the most attention right now in terms of prison reform?
Well, I think, as you point out, here in New York, there's been with our governor and our legislature, there's really been a partnership to have criminal justice reform in the system, whether it was the recent bail reform or looking back at resentencing and the sentencing structures. As I noted in my earlier remarks, when people talk about ending mass incarceration, it's defined as really cutting your population in half. We've achieved that here in New York. Our population is now at 36,066, but that's not the end, right? We need to make sure that we continue to look at who's coming in our front door, who's being prosecuted for what crimes, and why they're coming to prison. And then when they're in prison, how are we funding our prison system to deliver appropriate programs to make sure that we return people to society as productive members, people that can go back and continue to be that father or that mother or that son or that daughter that maybe they weren't because they made one singular mistake, or maybe they made multiple mistakes, right? And we can offer as many progressive programs, like a lot of the programs Mr. Bartley talked about that he was involved in at Sing Sing, whether it's Voices Within or rehabilitation through the arts. But it takes the individual to recognize that there's a path forward and that there's a usefulness to that incarcerated individual. And I think making sure that our population knows that everyone has a clean slate once they come to prison, that the opportunities are theirs to set the path to return back to the community. And I think that if we continue to build on that progress in New York State, we'll continue to drive our population down. And at the same time, by the way, while we drive our crime rates down, we are one of the safest large states in the nation, despite only having 36,000 people incarcerated. So that says something about the nexus between crime rates and incarceration, right? We are a safe state, but yet we continue to decrease our incarceration rates, which is a phenomenal success story for this administration, this legislature, and I'm really proud to be part of an administration and a department that truly believes in rehabilitation and returning individuals to the community.
Thank you.
I have a follow-up to that question for Mr. Martuscello. When I hear talk of criminal justice reform, in my mind, I see advocates having discussions with legislators, lawmakers, but I don't see correction professionals in my mind's eye, nor do I see it in the media or anywhere else. So my question is, how do you think that the ideology or the perspectives of correctional professionals should be infused into the reform discussion?
I think it's a true partnership, and it's funny you say that, Mr. Bartley, in that you're right. You're not going to read about our true perspectives and our beliefs in the media. Unfortunately, sometimes the media only wants to write things when we're at odds, right? But throughout this pandemic, every 2 weeks, the commissioner and I and members of the executive team have calls with advocates to update them on where they are, what we're doing, and for them to give us real-time feedback, because we recognize we have facilities 52 across the state. We can't hear everything, and there are some good eyes and ears, incredible messengers that we can use to get information and to give information. So having partnerships is truly critical with bringing my perspective to the table and then hearing their perspective on how my philosophy may impact positively or negatively on incarcerated individuals and or their families. You're probably aware that the governor a number of years back started the Reentry Council. It's something the commissioner and I attend every time that they have a meeting, and those are real credible messengers, really carrying the voice of the advocates and the families back to us, giving us real-time feedback on the implications of our policies, And they're telling us when we're doing it good, they're telling us when we're doing it bad, and that we can make adjustments. And I think getting those people in the room from multiple mindsets, and regardless of what topic you're talking about, whether you're talking about in a school system or an administrative area or a public business, bringing diverse perspectives to the table so you could work it out and come out with a more rounded policy is always the best case scenario when formulating policy and impacting lives.
Thank you. I want to bring it back to Dr. Norice-Tra for a minute. And this question is really both as doctor and daughter of an incarcerated parent. If you were an advisor or consultant to correctional officials, whether in New York or Texas or anywhere, how would you encourage them to consider the challenges, particularly of COVID-19, but also perhaps more broadly in terms of how correction administrators do their work based on your experience?
Yes, I would encourage them to see this from the lens of the people behind bars being human, for them to see the humanity of men and women behind bars, that they are 5/5 human and deserving of every public health precaution that's being taken on the outside. And it's a tragedy for them and their families who have waited years and even decades in some cases to lose life and freedom to COVID-19 before they're released.
Thank you. And I have one more question for Superintendent Capra, and then we're going to go to some audience questions, and we're not going to be able to get to them all, but there have been so many. Superintendent Capra, what is your vision for corrections more generally? And perhaps how has the COVID-19 crisis affected that? You've been a leader for quite a number of years in terms of how you've run the facility in Sing Sing, whether it's the TEDx events or whether it's Dan Slepian's work or the many programs that you've encouraged and the outside visitors that have been able to come in. But going forward, having kind of gone through perhaps the biggest challenge of your professional career, certainly at Sing Sing, how would you say that your vision has been altered, inspired? Does this, the expression every crisis is an opportunity, has this opened up new ideas for you? Going forward, what's your view of corrections and how has it perhaps changed through this horrible crisis that we've just gone through and are still going through, I should add?
Well, I think EDC Martuscello kind of really summed it up very, very well when he spoke about what is the new culture of the administrators in the New York State Department of Corrections Community Supervision, and what is their view? Their view, and we have all been put into these places because we agree with that view, which is to get the people who are incarcerated on a certain track to get them back into the community and be successful in this experience called prison. What do we offer them? What programs do we offer them? What educational pieces do we offer them? So, of course, this pandemic has really, changed our norms, but our values remain the same, and we're resolute in becoming whatever that new norm is going to be. We're going to continue to push forward and build on on this foundation of really where we were so many, many, many years ago. What the prison system looked like it really has nothing to do with today's world. Today's world is so much more progressive in looking at people as individuals, making sure that they get the skill set needed or taught the skill set needed so that when they get out, they won't come back and visit me other than to have a cup of coffee or maybe go to a TEDx or another event. So I think that is and has been our vision. And I think that is where we're going to continue to move forward. Of course, the pandemic has, forced us to take the appropriate safety measures so that we can continue to move forward. And I think we are doing that. There is ways in which we are putting our school building together. Our educational people are getting together now and figuring out ways to offer basic education and higher education, including our vocational programs. How are we getting that done and accomplished in this COVID moment? So I'm excited about that. I'm excited about moving forward and getting that moving at a pace that we could really see a change from where we were 6 or 7 months ago to where we are now. And I think it's going to be a positive thing moving forward as we really start embracing what our new norms are and start to figure out how we continue to be successful in educating the men. That are incarcerated.
If I could just add on 1 second,
Please.
Dr. Howard, before you
Yes.
move on from that, I think Mike's points are well taken. And I think, this governor here in New York, Governor Cuomo, he's really pushing everyone to build back better. So as that translates to the Department of Corrections, I mentioned our utilization of technology and tablets. So we are currently right now looking to see how we can do just that, build back better and leverage our tablets to deliver our curriculum, whether it's for pre-GED, GED, and leveraging it with our college partners. We offer college programming in over 30 prisons across New York State, how we can continue to do that. We did that through WebEx and innovative ways through partnership, but how can I keep the regular programs running that the incarcerated population so needs? So we will be piloting later this month at 5 institutions, utilizing the tablets to deliver a hybrid like they're doing in the public school system. When they're not sitting in the classroom, the teacher will be able to interact with the incarcerated individual via the tablet, doing quizzes and lesson plans and interacting with comments and feedback on their work. Technology is something in the corrections professional for years was kind of something looked at as could be dangerous, could be manipulated. We've totally embraced technology, and this pandemic has driven us even further to really say we can do better by leveraging technology in the system. We must do better. And this is a step forward in this pilot to hopefully, God forbid this happens again, that we don't have to suspend programs, just deliver it in a different way.
Yeah, no, that's a great answer, and that's very promising. I'd like to turn to some of the audience questions, and we're really going to have to cut most of them out, sadly. And maybe we should have budgeted 2 hours for this discussion. There's so many questions that keep flowing in. I want to kind of merge a few, if I may. There are several questions that had to do with kind of the conditions inside, the timing of when certain measures were taken, and then kind of the treatment of people who are testing positive. So one is about, and actually from my friend Martin Tankleff, who was spent over 17 years incarcerated before being exonerated, who's asking about when certain social distancing protocols during meals were implemented, face masks, face coverings, were they medical grade, were they really effective? Obviously, everyone was kind of behind the ball on this one, and I think if we knew then what we knew now, we'd do things differently, all of us. But how did that process work? And then there's another question that I want to integrate in that in terms of something we've been hearing a lot of states is that when people are testing positive, they're being sent to solitary confinement. And then that weaves into another question, which is on the mental health possibilities. Since we know that solitary confinement can really create or exacerbate mental health challenges, how have those kind of that confluence of different challenges worked out?
Sure. So there's a lot. So let me try to unpack that a little bit. As you mentioned, I think that there was a lot of direction early on from the CDC in terms of face masks. And it started out where first we were preserving face masks for medical professionals and first responders, and that no one should wear face masks. And then that evolved to if you had a face mask, you should wear a face mask, but we should still focus on medical professionals. So we followed that evolution under CDC guidance. And early on, we preserved those for medical professionals or individuals working on isolation units or in quarantine, and to the incarcerated population that was positive and in isolation. And then that continued on where then staff were allowed to wear their own, and the incarcerated population was allowed to utilize their handkerchief as a face mask. And then we quickly turned to mandating all staff to wear face masks while on duty. And we began issuing face masks to the incarcerated population. We had great partnerships with Hudson Link and the Cornell Cooperative, as well as the Justice Alliance in providing a number of face masks to both the incarcerated population as well as staff. We make face masks readily available, and we've distributed both surgical grade face masks as well as cloth face masks to the incarcerated population. They are provided and replaced on an as needed basis. So that's regularly something going on because as we've learned from the science here in New York, face masks are really critical to trying to stem the tide of this virus and protect each other from the spread. In terms of individuals coming positive in isolation, we put together comprehensive guidelines of the services and the things that should be afforded to individuals while they're in isolation, while they're in quarantine, access to phone calls, access to the kiosk to send secure messages, what are the cleaning protocols, and the access to the bleach solution. We in New York actually produced an alcohol-based sanitizer, New York State Clean, which, early on the thought is, this isn't something that we would give the incarcerated population. We quickly changed that, looking at what the science was saying and how this could help kill the germs. So this is readily available throughout our institutions in major areas as well as on housing units. In terms of solitary confinement, we did not use solitary confinement for the purpose of isolating individuals. Now, there were certain facilities that we did transform areas that were previously used for this purpose to house those individuals because they were uniquely situated with having a shower, a sink, and a toilet in the actual cell. But again, as Superintendent Capra said, it's also what goes with that. It's not the traditional solitary confinement as you would think of. It's giving them their personal property. It's allowing them access to the phones, to the kiosks, to the tablets. We've deployed in our restricted housing units tablets that can access law library, not only the tablets that you have in general population, but also tablets that are preloaded with content. So again, it's about getting through this together, making individuals comfortable so that they can overcome the virus, get through their 14 days, get released from isolation, making sure that they're fever-free for the 72 hours before they're released, and communicating, right? This isn't a punishment. This is about safety. It's making sure of your well-being and that of the individuals around you. So that was really critical as we moved forward.
Thank you.
Thank you. Thank you. I have another question, one from Tracy Tynan. She asks, are there plans to allow volunteers back into facilities?
Yeah, so volunteers is a strong network in New York. We have over 5,000 registered volunteers within our system. So yes, absolutely, we anticipate volunteers coming back and in full force. It's about when, right? So we've instituted under New York Forward a gradual reopening plan. First, it had to do with visitation. It had to do with returning programs. It has to be incremental. We have to watch what's going on in our communities before we introduce additional individuals back into our facilities. So we need to monitor the gauges and make sure we open them at the right time and bring them back. So yes, they're coming back. It's a matter of when as we continue to monitor the spread and impact of this virus.
Great. I have another quick question. This one is from Antoinette Ozzie in Pittsburgh. She asks, if a person tests positive, what is your treatment plan?
Yeah, so if an individual tests positive, they are isolated from the remainder of the population. They're seen by medical at least twice a day, and depending on their symptoms, as Dr. Norice-Tra said, there's a lot of individuals that are asymptomatic, that have no symptoms whatsoever, that we just monitor throughout their period of the 14-day isolation, and then they return to general population at the conclusion. There's other individuals that need to be cared for medically in our isolation and medical units where they're cared for directly. And then we have a vast network of hospitals that we have agreements with, where if an individual reaches such a medical level where the respiratory condition requires treatment in an outside hospital or use of a ventilator, then we transport them to an outside hospital for more acute care. We have a number of secure wards where we actually have correction officers and whole portions of hospitals dedicated to our agency, where if we have individuals that need to be at outside hospital. So we have a series, depending on an individual's ailments and the systems that they're displaying, to respond appropriately.
Now, we're into overtime, I have to mention, so I want to thank our audience who's sticking with us, and it's a good sign that so many are, but I do want to wind things down. I'm going to ask one last question and then say a few things to close it out. And this comes from Katie in San Francisco. What would EDC Martuscello and Superintendent Capra do differently in their response to COVID if they had a do-over? So let's, in a way, go back and say we're in mid-March or early April. and we know what we now know, how would it go differently?
Yeah, I mean, I think the biggest thing, from my perspective, and I think, there's a ton of little things you can do along the way that you might want to do better or could do better. But I think the biggest one thing when it comes down to knowing the science now is how beneficial the use of masks were. I mean, had we deployed masks earlier and really recognized that that was one of the biggest ways to stem the spread of this virus, that I think that we would have mandated that a lot earlier for both staff and the incarcerated population and getting it out. We have a supply of PPE that we keep on hand to make sure that for infectious control reasons. So we have the PPE to deploy, but not having the guidance from the CDC and wishing we did that earlier in the process, I think was big. I think shutting down visits, we did that in mid-March. And as I said, that was one of the most difficult things that we had done. So, I think that was done close to the right time. Could we have done that a week earlier, 2 weeks earlier? But I think the masks would definitely be the top of the list, and deploying those much earlier, and not even deploying them, mandating them to be worn in the system.
Yeah. And Superintendent Capra, how about you from your perspective in Sing Sing?
Well, as the science changed, so did our policies, as we've all said. For us, we had a cohort area that we were ready to use, and when it actually came down to using it for this pandemic, we realized that wasn't going to work for us. So within 8 hours, we changed our cohort area to a different part of the facility, literally moved inmates from one place to another and got it ready to go. So the realization of where I had it planned, and it had been planned for probably 20, 30 plus years, was just not going to work for us. So we looked at a number of different things that we would need to make this cohort area work, the location to our clinic, the staffing involved. I think one of the things that you think back on when you're developing a plan for any kind of cohort areas, I really didn't think about staff going out. You think about your prison as this place, and all of a sudden your staff's not coming to work either. So that was a realization for us all as we started to develop these new areas. So I think what we did it quickly. We were efficient in doing it, and I think we've met a lot of those challenges. I think we, like the rest of the country, like the rest of the world, have learned a lot of things along the way. I'm not so sure we would have done anything differently. We really were going based on the science. We put our heads together. We tackled the job, I think, and we continue to tackle it. I think the communication level and building a culture of trust and bringing in everybody inclusively, including the population, was key. We did that early on. So I am proud of the way this department responded to this pandemic. I think we all, and I'll include all the rest of my brother and sister superintendents out there, were equally concerned about all the constituents that we've had to deal with. And I think we put our heart out there, and we felt the pain that people were going through. And hopefully, if we have to deal with this again, we'll be a lot more prepared, because now we're ready for this. But I think we've done a pretty good job of doing what we can with what we have.
Thank you for that. And thank you to all of our panelists for taking part in this engaging and open conversation. And on behalf of our attendees and the Frederick Douglass Project for Justice, I can't tell you how much we appreciate your comments, your transparency, and your willingness to engage. And really, the humanizing perspective that has come through all of your responses really embodies the very mission of the Douglass Project. And so we're just so grateful to you for participating in today's event. And I also want to thank our attendees for being with us today. Thank you for all the questions. I'm sorry we didn't get to answer so many of them. Maybe we'll have to do a follow-up or more such events soon. But we're really glad that our attendees took the time to learn and to care about the impact of COVID-19 on incarcerated people. And I want to add that as soon as the COVID crisis is behind us, and we all hope that'll be very soon, but we know it will be at least a few more months. But when that time comes, the Douglass Project will begin bringing people inside of prisons across the country, allowing them to connect with the humanity of incarcerated people. And so I invite you all to visit our website at douglasproject.org, sign up for our mailing list, and eventually, of course, to join our prison visits when they begin. So thanks again, everyone, and have a great rest of the afternoon.
Dr. Norice-Tra, I wish your father well in Texas, ma'am.
Thank you so much.
Thank you, guys.